The results of a CT scan review undertaken by the Cypress Health region are being revealed. A 13% variance rate was discovered, enough to warrant a second review. The initial review was undertaken by the region in July of 2010. All CT scans from January of 2008 to May of 2010, over 7,000, were reread. A random sample of 449 CT scans from January of 2005 to November of 2007 were also re-examined. A variance rate of 12 and 13% was discovered, a number the region says is significant and demands an all-encompassing review of CT scans.
We will be doing a complete review of all CT exams during the period of October 1st, 2004 to December 31st, 2007. And again, we will be starting with the most recent scans, as we know that this allows patients the best opportunity to affect their care. This will involve approximately 8,000 further CT exams.
A CT scan is used to diagnose a number of different health concerns, and having a 13% clinically significant variance rate from the review means a number of health problems could have gone unnoticed. Dr. Radevsky gives a few examples of the ailments commonly diagnosed through CT scans.
It's a wide variety. It could be anything from, backache, it could be abdominal pain, could be something related to headache or neurological symptoms. So it's really a wide variety of testing. It's not one particular area that we found that there's a higher variance.
All of the CT scans from October of 2004 to May of 2010, when the problems were identified, were performed by one doctor in the region. This physician announced his retirement days after the initial review started. The only comment from the region about this doctor is that he was overworked during the time the mistakes were made, and that the review is about patient safety and quality, not about one particular person. There is still only one radiologist working within the Cypress Health region, but Vashon says they're making an effort to create a more sustainable workload.
We are working with Regina Associated Radiologists Clinic, and because of new technology, they have been able to provide a tremendous amount of assistance to us for our radiologist who is here working on the ground. The other thing that we've been doing is looking at how we bring locums in to provide support and relief to our radiologist who's working in Swift Current.
The region has already re-examined over 7,000 CT scans, and they're estimating another 8,000 as part of the second review. And with the recent issues that have come to light, the region feels using new technology to send images over to Regina is an adequate way to provide health care and maintain quality patient services.
We want to be in a position where we're always evaluating, are we providing quality services? And so, yeah, we think this is a good start. We know that our quality journey is never over, though. So, we're always going to be striving and looking for ways to do this better, to ensure the safest kind of care that we can for our patients.
The initial review over the summertime cost about $1 million, and the expectation is that the second review will cost even more than that. The Cypress Health region will use the same company to do the second review, and it's already started. For Southwest TV News, I'm Kara Rapke.